America's healthcare system is already on the brink of collapse, but the cuts to Medicaid and Medicare that Republicans have been pushing through the last 2 nights in the middle of the night will cause total chaos.
13.7 million Americans will lose their health care.
As a result of this bill, nearly 14 million Americans will lose their health care.
In case you forgot, we pay for Medicare. Yep. Go check your pay stub. We pay for it. So where are the cuts coming from? Where are they going?
Aren't y'all mad? I'm mad.
Nobody's taking away your Medicaid, they said. You're not going to lose your health insurance. Don't worry. The gaslighting?
$500 billion in automatic cuts. But he's getting $45 million for his parade. Woo!
Of taking from the fucking lower class, the people who need the help, people who don't have the fucking money, people who don't have anything, you're gonna take from them and give to the fucking wealthy.
And literally it's just a tax break for the billionaires. The people who are already wealthy, they're just going to be making more money.
Not only will the big beautiful bill be cutting Medicaid and SNAP, it'll also be cutting Medicare as well, in the amount of $1.2 trillion.
What the hell? What the hell? What the hell? What the hell, Beyonce?
Nobody's coming for your Medicare, they said. Nobody's taking away your Medicaid, they said. You're not going to lose your health insurance. Don't worry. The gaslighting is off the fucking charts.
I take care of dying people. They die when they don't get health care. And I see them at the end of that. So when you cut $880 billion, that means you're okay with people dying. If you think that's okay. And you may be like, wow, Dr. Chela, you're using a lot of foul language. Yeah, what else do you want me to do? Nothing seems to make sense to a lot of people. That's what this is. When you cut $880 billion, that means poor people die. And that's on you if you don't stand up and say something.
America's health.
What's up, y'all? Mr. T here. Very excited to be back in yet another episode. So today's video is going to open a lot of eyes. People across TikToks are breaking down in tears, angry, hurt and scared after Republicans passed a brutal budget bill that slashes Medicaid, Medicare and food stamps. Now, not all of these people in the video are MAGA voters. Some are just everyday Americans caught in the crossfire. But here is the big thing. The bill was passed only by Republicans backed by Donald Trump himself. And a lot of voters who cheered on him, they're realizing now they voted for the very people cutting their benefits. Let's watch these clips that I've put together for you guys to watch, and then at the end I will come back and break it all down for you guys to understand what's going on. Stay tuned.
Your system is already on the brink of collapse, but the cuts to Medicaid and Medicare that Republicans have been pushing through the last 2 nights in the middle of the night will cause total chaos. My name is Lex. I'm a nurse. I am quite literally waiting to go inside for my shift this morning, but I really feel like everyone needs a little bit of context as to why this matters and why this is so catastrophic. These cuts, and the cuts are in total over $1 trillion to both Medicaid and Medicare, will cause sheer and utter chaos in our healthcare system. Now, they want to cut over $800 billion to Medicaid alone over the course of 10 years. What does that mean? So that's roughly 10% of Medicaid's budget. Every year, Medicaid has around $800 billion to spend. So if you cut $800 billion in 10 years, that's 10%. Medicaid is the largest reimbursement of nursing homes, okay? Without Medicaid, and any cuts to Medicaid means your grandma and grandpa and your parents are going to be neglected in their nursing homes. And I'm not saying that because the staff is at fault. I'm saying that because when budget is cut, nursing homes cut staff. Right now, today, as I'm making this video, nursing homes are already making nurses take care of 30 to 40 patients. We can't be everywhere at once. Those ratios are about to grow. So a 10% cut to Medicaid does mean that there will be massive neglect in our nursing homes. It also means that some nursing homes are going to shut down completely. And that means that the hospitals you and I rely on, every single hospital in this country is going to have a delay getting people out of the hospital. People are going to sit and wait for discharge because a lot of the folks that come into the hospitals need to discharge to nursing homes, whether it's for rehab or long-term care or whatever. That's not going to happen. They're already full. The nursing homes are already full. Now they're about to get their budget cut. We are not going to be able to move people out of these hospital beds, you guys. And that means catastrophic levels of delays in care for everyone else. I don't know how much clearer I can be. If there are no hospital beds, there are no hospital beds. That means no beds for your car accident. Sorry, you come in with a broken femur and a broken pelvis. If we don't have beds, we're not going to treat you in the parking lot. We legally can't do that. So this is going to affect everybody. Private doctor's offices who primarily take Medicaid patients, if you go to that doctor and you don't have Medicaid, if they shut down, does it matter? Does it matter? Simply put, the disabled and the elderly are going to die because of these cuts. And Republicans know that. They know that. That's why they're doing these votes at 1 in the fucking morning. They know that only 15% of Americans, regardless of political belief, 15% support Medicaid cuts. That is one of the most unpopular policy positions in history. Not to mention all of the rural hospitals who will simply put shut down. A lot of these rural hospitals are almost completely reimbursed by Medicaid and Medicare. If they lose that money, they will shut down. A lot of them are already on the brink of shutting down as it is, which means that rural Americans, small town Americans, will have to drive hours to see a doctor. That means death. There's no other way to put this. So I hope that gives some context as to why every single person watching this video needs to be up their elected officials' assholes right now. You need to be calling and calling and calling, emailing. If you live in DC, go knock on that damn door. If you live near one of their offices in your congressional district, go knock on that damn door. We need to be in the streets. We need to be online talking about this. We need to be making as much noise as possible because our elderly deserve better, our disabled folks deserve better, and we deserve better.
You are making the biggest cuts to Medicaid in American history. As a result of this bill, nearly 14 million Americans will lose their health care, and millions more will pay higher premiums, co-pays, and deductibles. That's just a fact. Hospitals will close, nursing homes will shut down, and people will die. And not a single one of the proposals in your bill is about making Medicaid work better. Not one. Your bill doesn't save Medicaid. Your bill destroys Medicaid. We can and we should make Medicaid work better. Absolutely. Instead, your bill creates more red tape, more hurdles, and kicks struggling people off their health insurance. Now, who asked for this garbage? I mean, more red tape? Oh, boy. And if that's not bad enough, you are making the biggest cut to food assistance in American history. According to the nonpartisan Congressional Budget Office, at least 5 million Americans will lose food assistance under your plan. 5 million more hungry Americans because of this bill. And that's probably a lowball estimate, by the way. You're slashing benefits from children, from seniors living on fixed incomes, from veterans who served this country and now rely on food assistance just to get by. And why? And why? You are literally taking food off kids' plates to buy Elon Musk another yacht.
71,000 people in Alaska. 629,000 in Arizona. 5 million California. 349,000 in Colorado. 182,000 in Iowa. 486,000 in Kentucky. 740,000 in Michigan. 326,000 in Missouri. 72,000 in Nebraska. 566,000 in New Jersey. 2 million in New York. 727,000 in Ohio. 829,000 in Pennsylvania, 681,000 in Virginia. This is just a snippet of the amount of people that are about to lose their health insurance, their health benefits. My daddy said that, to be healthy is to be wealthy. And so now they're coming to take that form of wealth away as well. They're taking that away and giving it to the rich, to the billionaires, to the people that don't need it. Transferring the wealth from the bottom back up to the top.
I'm currently doing one of the most ridiculous things I've ever done, which is riding a Lime bike to the U.S. Capitol at 3 a.m. because Republicans are trying to gut Medicaid. And if I am a pediatrician, works in D.C., who just works past midnight, trying to make sure that my Medicaid patients get the best care possible when they need it, I'm sure as hell going to roll up in my Lime bike to the U.S. Capitol and have something to say about it. I have no idea what this is going to be like. I don't really know if I can have any impact. But you know what? There's people there. There are members of Congress there. And this is how we're rolling up. So I'll keep you posted.
So the Republicans have a real problem. They are trying to cut $880 billion out of Medicaid, and there is not enough waste, fraud, and abuse to cut $880 billion from Medicaid, not even close. And so they are coming after people's health care, pure and simple. And they'll find many ways to talk about this. They'll talk about work requirements. But let's be clear what they're talking about. They're really talking about work reporting requirements. We have already seen this experiment in Georgia. Our governor has a program called Pathways to Coverage. He ought to call it Roadblocks to Coverage. We've got over 500,000 people in Georgia who are in the health care coverage gap. A lot of those folks could be covered right now if Georgia would just accept the Medicaid expansion. Instead, we've seen this program, and 20 months later, they've covered a whopping 7,000 people. That's it. 7,000 people. And so all of these are just tricks. These efforts of putting red tape up, asking people to certify their hours month after month after month, does not incentivize work, but it does a very good job of keeping working people off of their health care.
Nothing good. So y'all, last night while we were sleeping, the House went ahead and passed that budget bill. Come on, sip a little tea with Auntie. Let's talk about it. So y'all know I've done my research before I get on here and I speak on anything. The House passed that bill while we were sleeping last night. What's going to be affected, Auntie? Medicaid, Medicare, as well as SNAP benefits. Now, a lot of people are like, oh, well, that doesn't affect me. Let me scroll past the video. It may not affect you directly, but what about your parents, your grandparents, your children? Thousands, millions of people, y'all, are going to be affected by these cuts. Man, it's so much, too. $200 billion will be cut from the SNAP program. $600 billion will be cut from Medicaid. Medicare, the number is still being tossed around how much will be cut from that program. Come on, man. So many people rely on these programs, y'all. Think about it. Think about a child who only gets fed most of the time in school as it is because their mama receives SNAP benefits and it's not enough. Now imagine them cutting it even more. Children are going to starve, y'all. A lot of children may starve. Think about your grandparents that only have a certain amount of money that they receive from like Social Security or a 401k plan or something like that. So they rely a whole lot for their medicine and doctor visits and surgeries and everything else to come from Medicare. And they're going to go into that money on them as well. Think about all the children who are on Medicaid, my children included, receive Medicaid. What type of cuts are they going to take from Medicaid? Is the amount of times they can go to the doctor going to be cut? How many prescriptions? They already had started to do that. What's going to happen? What will these cuts affect, y'all? That's something we should take into consideration.
So we all know that the Medicare, Medicaid, and SNAP cuts did pass through the House this morning, and that we're currently waiting for them to see what's the next step. A lot of people are upset because they lied and said that they weren't going to do all of these components, which we already know that when they say something that they're not going to do, they're going to do it. Okay, so let's get into the gist of how much money they're going to actually cut if this passes through the Senate. So it shows that they're going to take and cut $200 billion from SNAP. Okay, if you don't know what that is, I kind of just went over it. I have videos to tell you about what it is. If not, Google it. It'll tell you what it is, okay? We also have $600 billion cut in Medicaid. $600 billion to cut in Medicaid. And then they did not have an amount of money they're going to cut on Medicare. All it said was like some major big cuts. They don't have a number figure, so we don't know how much that will be. But there will be cuts if this passes through the Senate. And they love to be sneaky, so they voted like at 2 a.m. this morning, 1 a.m. the other morning, while people are sleeping. I still don't understand the dynamics of that. But this is what we're looking at, people. So this is so horrible because there are going to be a lot of people, children, families, loved ones, people on disabilities, all these things that are not going to have coverage if this passes through the Senate. Tell me how you think about this. I think we're all on the same page. But this is very much giving the rich staying richer and the poor figuring out how to live.
Beautiful Bill Act. So the U.S. House of Representatives just passed the One Big Beautiful Bill Act. And it's aligned with President Donald Trump's agenda. Now, while it introduces significant tax cuts, it also entails substantial reductions to critical social programs, starting with Medicare, because they face cuts totaling almost $500 billion over the next decade due to pay-go rules, potentially impacting services for millions of seniors and disabled individuals. Medicaid is set to be reduced by nearly $700 billion, with new work requirements that the Congressional Budget Office estimates results in 8.6 million people losing coverage. It also slashes SNAP funding by $267 billion over the next 10 years. They are also imposing stricter requirements for approval and then shifting more financial responsibility to the states. These changes could affect nearly 11 million Americans who rely on food assistance. Now, while the bill did mention no tax on tips and overtime, the biggest tax benefit is to corporations and high-income earners, and it does so at the expense of the most vulnerable populations, including children, seniors, and low-income families. The bill will now move to the Senate, where the debate will continue. Please stay informed and reach out to y'all senators to voice y'all concerns. Because while everybody makes a big deal about presidential elections, the people in your local state and government offices, those people matter too.
Hey, MAGA. Republicans decided last night, early wee hours, to sneak in cuts to Medicare. Medicare. Not just Medicaid. Now it's Medicare. They just snuck it in. You know why? Because they need money for those tax cuts. That's all they care about. How many people do you know are on Medicare? There's a lot of them. A lot of people with disabilities are going to feel this. Oh, it's happening. It's happening, isn't it? Everything we said was going to happen. I mean, I'm an empathic person, and I do feel something right now for you guys, but I really don't. I look forward to the videos you're going to make because it's going to happen. Hold on. I'm going to say this. $500 billion in automatic cuts to Medicaid. But he's getting $45 million for his parade. Woo!
You pay into Medicare. I don't want us to argue about this. There is no left, there is no right, there is no GOP, there's none of that. Listen to me again. You pay into Medicare. If you don't believe me, and if you are gainfully employed at this very moment, I want you to go and look at your pay stub, whether it is a physical copy or if it is a digital copy, and you will see the deductions that are taken out of your paycheck before you get your money. Are you listening? You pay into Medicare. Does that make sense? Did I stutter? Did I make this up? Absolutely the hell not. And so since you are paying into Medicare and they are looking to cut $500 billion in Medicare with this new, big, beautiful, fabulous, gorgeous bill, please understand that if you are paying into Medicare and they cut Medicare, where in the hell are they getting the money to cut it from?
Those won't take effect until 2028. And then the Medicaid changes won't come until 2029. So when a Democrat does get elected again, if we do have elections, God forbid, are people going to remember that it was Trump that did this? Even though it'll go into effect when the Democrat is president. Will we remember this? Because this happened last time with the tax plan. Everybody complained about Joe Biden's or taxes under Joe Biden when we were under Trump's tax plan. Are people going to remember this?
I am going through the big, beautiful bill that the Republicans passed last night in the House. And when I tell you there are specific cuts to Medicare, not just Medicaid, to Medicare. So there is section 44121, which is a moratorium on staffing requirements for long-term care facilities. That's just one of the cuts. So they basically will reduce the amount of people that are required to be on staff at a facility. And as someone who's gone through this with family members, I can tell you they're already short-staffed. The second thing that they do is they're going to reduce the requirements that these people have to work there. I can also tell you that there is a shortage of people who actually have nursing skills. They often have people who show up that have a couple of weeks worth of training and don't know how to administer medications or certain care procedures, and that makes people's lives so much worse when you don't have someone there that can actually help them. So these cuts are going to be devastating. I'll be going through the rest of the bill today. Please follow, and I will give you as many updates as I can.
This may sound morbid, but I'm so glad my parents are no longer here. I promise you that. I remember the last time I talked to my mom on the phone, that was the happiest I had heard her in a long time. You're cutting so much from Medicaid, Medicare, and the SNAP program. People are going to be out here fighting for their lives. They're going to be out here starving. Children will be starving. Because if they make those cuts and they say, oh, well, you don't qualify for food stamps, that also bleeds into school lunch. It bleeds into so many things that children will not be able to qualify for due to no fault of their own. My parents lived off of Medicare. They had to have Medicare. I can only imagine how hard it would have been for them to live through all of this as elderly people. It is not fair. It is not right. And this is going to impact so many people using these terms of words like impact, and people are going, they're getting numb. We're becoming numb to these terms. People just scroll past videos like this that talk about it until it actually hits home for them, until it actually manifests itself into the physical form in their lives and impacts their financial setting, impacts their financial pockets. Like, people aren't thinking about WIC. They're not thinking about the fact that children need formula to live off of. And you're planning on cutting off SNAP benefits for children who are 7 years of age or older because their parents aren't married, or maybe because the mom is a single mother, the father is a single father. So children that are 7 years of age or older don't deserve to eat? And y'all aren't giving people jobs? What the hell is going on?
The government voted to cut Medicare, Medicaid, and SNAP benefits. And literally, it's just a tax break for the billionaires. people who are already wealthy, they're just going to be making more money, while people who make like less than $50,000 a year are going to actually be making less money. Like, my thing is, if there's the 1% who is extremely wealthy and is hoarding all of the wealth, and then everyone else is just, living paycheck to paycheck, or everyone is just, trying to get by, are these like billionaires and like company owners and CEOs not aware? Like, if you guys are hoarding all the wealth, like nobody's going to be able to afford shit from you guys. Like, if Medicare gets cut, Medicaid and SNAP, and people have to come out of pocket to pay for all of those things that they actually had the benefits for, then they're not going to be able to afford all the other capitalistic shit. So like, these companies aren't going to be actually getting the money that they think they're going to be getting. Like, I kind of think that this is going to be backfiring, because people are not going to be able to afford shit from these large companies. They're just going to get the basic things that they need, because now they're being literally forced to pay for things that they had the benefits to cover. Because now all of a sudden we're just going to get rid of a bunch of benefits, so then the extremely wealthy people can earn more money per year. That doesn't make any fucking sense. But the thing is, I feel like it's just going to be their karma, because no one's going to be buying shit from any of these large companies. Anyone who's hoarding the wealth is not going to be getting any more wealth, because you guys are hoarding it all, number one. And number two, nobody literally can't afford to buy any more of your shit. It's not even like they're choosing not to, like a boycott. It's like they actually can't afford to do that. So, but yeah, that should be interesting to see. But it's still horrible that they cut all of these benefits. Like, what the fuck is actually going on?
I take care of dying people. They die when they don't get health care, and I see them at the end of that. So when you cut $880 billion, that means you're okay with people dying. Fuck you. Fuck all you, if you think that's okay. And you may be like, wow, Dr. Cheda, you're using a lot of foul language. Yeah, what else do you want me to do? Nothing seems to make sense to a lot of people. That's what this is. When you cut $880 billion, that means poor people die. And that's on you if you don't stand up and say something.
Why in the world would you be in support of taking from the fucking lower class, the people who need the help, people who don't have the fucking money, people who don't have anything? You're gonna take from them and give to the fucking wealthy. Why the fuck would you be in support of that? What the fuck has the ultra wealthy done for you? Why would you be in support of taking away from regular ass people like me and you and give those who are in a whole different tax bracket, a whole different world, a whole different reality than me and you? And you're gonna be in support of that? You're going to be in support of taking away from elders and disabled people and the poor people and the working class, regular ass people who need the help? And you're going to say, nah.
Oh, if they take Medicaid, oh, if they cut SNAP, those people who don't want to work have to work. No, I don't think you're looking at the deeper picture. Nurses, doctors, CNAs, what is it called, LPNs, all of them going to lose their jobs too. How, you may say? Well, if they cut all those billions of dollars in Medicaid, most of the people in hospital depend on Medicaid. Most of the people in nursing homes depend on Medicaid, which where RNs and doctors and nurses work. So if all of them die, who's going to fund the hospitals and the nursing homes? So that means that everybody else lose their jobs too. So I don't think y'all really thinking this out clearly. So all them Senates who got RN doctors, the RN daughters and all that, when they start losing their job and then, oh my gosh, God forbid they lose their job and they can't take care of their kid, they can't pay their house mortgage, what will they ever do? What will they do? Oh no. When their grandma die. Oh no. When their third cousin die and then they got to go to the funeral and they say, what did Mary Lou die from? And then they say, because Mary Lou was on Medicaid and you guys cut the Medicaid and Mary Lou died, and then what? Oh.
So here is what actually happened. On May 22nd, Republicans in the House passed a bill called One Big Beautiful Bill Act, named in honor of Trump. Every single Republican voted for it, every single Democrat voted against it. The bill hands out giant tax cuts to the richest Americans, and to pay for that, it cuts $625 billion from Medicaid. It triggers $500 billion in Medicare cuts and slashes SNAP, the food assistance program that helps millions of families. According to the government's own data, over 7.6 million people could be kicked off Medicaid. That's millions of people with no health coverage, some of whom literally depend on it to survive. Now, let me be clear, not everyone crying on TikTok voted for Trump or Republicans. Some of these folks are just regular Americans who are now stuck suffering the consequences. But at the same time, let's be honest, many people did vote for this. They supported politicians who promised tax cuts and smaller government, but didn't expect those cuts to come from their own benefits. Some ignored the warnings. Some thought the cuts would only hurt poor people in big cities or raise people on welfare. Now, they're realizing the cuts are coming for them too. The food stamp program SNAP is being cut too. That means people who were already struggling to feed their families are going far deep into hunger. And you know who gets hit hardest? Working families, single moms, veterans, and the rural communities. The very people Republicans claim to represent. Many folks in these areas thought they were voting for jobs, patriotism, and Christian values, but what they got was billionaires getting richer while they can't afford groceries. And this is not just Medicaid. Medicare is on the chopping block too. That's the program older people rely on after a lifetime of working. The bill triggers automatic Medicare cuts up to $500 billion starting in 2026. That means fewer service, more delays, and more out-of-pocket costs for seniors. So if you are a retired Trump voter who thought your healthcare was safe, you're just being thrown under the bus. So who wins from this bill? Billionaires, big corporations, private insurance companies, and who loses? Poor families, working class Americans, disabled people, veterans, seniors. It doesn't matter if you are red state or blue state, MAGA or not. If you are not rich, you are getting out. Simple as that. For those who did vote Republicans, it's time to admit something you were lied to. You were told the rich deserved more blacks. You were told the government was the problem. You were told immigrants were the reason things were hard. Meanwhile, behind closed doors, they were planning to take your healthcare, your food assistance, and your future. Trump and his allies sold you fantasy, and now it's becoming a nightmare. This is what we mean when we say F around and find out. For years, some folks laughed when others lost benefits. They said, that's what they get. Now they're crying because it's happening to them. But the truth is, this doesn't have to be about revenge. This should be a wake-up call. These programs, Medicaid, Medicare, SNAP, they exist because Americans fight for each other, not just for themselves. If this hurt you, remember it at the next election. Don't vote for politicians who give everything to billionaires and leave you with laughing but tears on TikTok. If this hurt you, remember it at the next election. Don't vote for politicians who give everything to billionaires and leave you with nothing but tears on TikTok. Let me know in the comments. Should we feel sympathy or is this just accountability? Whatever you think, this is the moment of truth in America. You should learn from it, speak up, and demand better. If you got value from this video, hit that like button, share it with someone who needs to see it, and subscribe for more. See you in the next one. Ciao.